Margaret, thank you for the warm introduction. Pandemics are global, but their impact is personal. When I first contracted malaria as an infant, my mother was worried sick. We lived in Liberia, where, as is still the case in many countries across Africa, if you didn't know someone who died from malaria, you knew someone who has suffered from it. After several days of vomiting, fever, and chills, I was taken by my mother to a nearby doctor. I was treated. I survived. But for too many children and their families, this is simply not the case. Today, millions of people remain out of reach of the medicines, bed nets, and the health workers that they need to protect their lives. Today, over 200 million still fall sick with malaria around the world. Today, 4 decades after I survived malaria, a child still dies every 2 minutes from this disease, a disease we know how to prevent and treat. Illness is universal. Healthcare is not. This is one of the greatest crises of our generation. I've learned in my life we are not defined by the crises we face, but by how we respond to them. A year ago, while caring for patients in rural Africa, I saw the relief on the faces of parents whose children had been dying from malaria and who survived after being treated by medicines and health workers, supported by programs that the US President's Malaria Initiative has helped build. Launched in 2005, the President's Malaria Initiative, which I'm privileged to serve and lead, is one of the most effective and efficient development programs in history. In its first 15 years, the President's Malaria Initiative has invested nearly $8 billion in hundreds of millions of mosquito-killing bed nets and sprays, life-saving tests and medicines, and heroic health workers in clinics and communities. Together with our partners, the President's Malaria Initiative has helped save 7.6 million lives and avert 1.5 billion infections. Now, this is something all of us in the malaria community should feel proud of. But in this past year, we have faced a new unprecedented crisis that has threatened to reverse these gains. COVID-19 has threatened this progress. I've been inspired by how the global malaria community continues to respond. Malaria campaigns that provide people with mosquito nets, ensure homes are sprayed with insecticides, and distribute preventive medicines for children, although initially delayed, have been adapted and sustained. And the health workers who carry out these preventative campaigns have been trained and equipped to provide these services safely. Now, let me be clear. While the malaria community has remained resilient, the progress we've made is under threat. COVID-19 is still straining health workers and clinics, and that is threatening to disrupt access to malaria testing and treatment. New mutant parasites and mosquitoes are becoming resistant to medicines and insecticides. And now unpredictable rains due to climate change are creating new standing water pools where malaria-carrying mosquitoes can breed, increasing the possibility that this disease could impact millions more who may have never been exposed to it. If we are to end malaria within our generation, we need bold action. And we need bold action in 3 specific areas. First, we must reach the unreached. Hundreds of thousands of children, especially in the world's most remote communities, die from malaria every year without receiving a single test or medicine. That is unacceptable. Too many pregnant women still go without the preventative treatment they need to protect their babies from malaria, leading to unnecessary stillbirths. That is unacceptable. We must target the regions with the highest burden of malaria, but the lowest coverage of bed nets, preventative treatment, tests, and medicines. And this has to include reaching the most remote communities. Simply, we must put the last mile first. Second thing we have to do is to make health systems safer and better. Too many nurses, midwives, community health workers, and others who are on the front lines of delivering malaria services still struggle without sufficient training, equipment, and even fair pay. In the face of COVID-19, some have gone without the masks, gloves, and gowns to protect themselves. We must invest more in the armies of health workers and the networks of clinics and laboratories they run. Doing so is not simply going to help us in the fight against malaria, but it's also going to help us respond to other threats, including COVID-19 and the pathogen that will cause the next pandemic. And the third thing we need to do is to end malaria faster. In this century, together, we've already helped eliminate malaria in 21 countries. But too many countries are still far from their goal of eliminating malaria. We need to bring countries closer to ending malaria. And to do that, we must leverage new data systems, technologies, and tools. The science, my friends, shows it can be done, and we should do it. You know, I was recently asked, why should we care about malaria now? I think it has to do with a four-letter word called hope. More people have died from infectious diseases than any other phenomenon in history. Humans have been in an existential fight with pathogens since the dawn of humanity. We are now at a turning point in this fight, in our fight against malaria. Losing this war against this disease will lead to despair in our fight against other pandemics. We all know this doesn't have to be the case. We must end malaria within our generation. And if we do that, then we create hope in the fight against future pandemics as well. And that hope is worth fighting for.